If you're alone, and you feel a crushing weight on your chest, this is not a wait-and-see moment. This is a countdown. Every minute your heart is starved of oxygen, muscle cells are dying forever. Not hurting. Not weakening. Dying. You'll be told to call 911, and yes, do that immediately. But here's the terrifying truth no one talks about. The average ambulance takes 8 to 12 minutes to arrive. And in those minutes, your survival is 100% in your hands. Most people do the wrong things. Some do nothing. Some panic themselves into collapse. But medical data shows that specific actions taken before paramedics arrive can double, even triple, survival odds. This is not folk wisdom. This is battle-tested emergency medicine. 6 protocols. Executed in order. Designed for when you're alone. Let's begin. We start with logistics because if help can't reach you, nothing else matters. Picture this. You've called 911. Sirens are coming. Paramedics reach your house. And they stop. Because the door is locked. Emergency response data from major US cities shows that forced entry delays add 4 to 7 minutes before medics can touch the patient. In cardiology terms, 4 minutes is an eternity. That's the difference between a stunned heart and a permanently scarred one. This is called the lighthouse strategy. The moment chest pressure hits, before weakness sets in, unlock your front door. Not just unlock it. Crack it open. If there's a screen door, wedge it open with anything nearby. Why? Because gravity is coming for you. If you pass out, you will not get back up to answer the door. Next. Turn on your porch light. Turn on hallway lights. Turn on living room lights. Make your home the brightest target on the street. Paramedics are trained to scan visually. The brightest house wins. Apartment or gated complex. Call 911. Then immediately call a neighbor or building manager. Have them wait in the lobby. Do not let a locked gate decide your fate. You've heard it before. Take an aspirin. But how you take it determines whether it helps in 5 minutes. Or 40. A heart attack is a plumbing failure. A plaque rupture. Platelets rush in. They clump together like sticky Velcro, forming a clot. Your mission. Stop the Velcro immediately. Here's the mistake. Swallowing aspirin. A swallowed pill takes 20 to 40 minutes to work. Heart muscle damage becomes permanent in 20 minutes. That math does not work. The solution is a chemical bypass. White right pointing backhand index chew the aspirin. 1 325 mg non-coated aspirin. OR. 4 baby aspirins, 81 mg each. Chew it into a paste. Yes, it's bitter. Yes, it's chalky. Ignore it. Chewing allows aspirin to absorb through the mouth and throat directly into the bloodstream. Clinical studies show platelet inhibition begins in as little as 5 minutes when aspirin is chewed. Unless you have a known severe aspirin allergy, this is the single most powerful self-intervention you can perform. This protocol is only for people who already have nitroglycerine prescribed. Aspirin stops the clot from growing. Nitroglycerine works on the pipes. Think of your artery as a highway. The clot is a wreck blocking lanes. Nitro widens the highway. It reduces the heart's workload and improves blood flow. But misuse is dangerous. Follow the 3-rule nitro protocol. Rule 1. Sit. Never take nitro standing. It drops blood pressure fast. Sit down first. Rule 2. Under the tongue. Tablet or spray goes under the tongue. Do not swallow it. Stomach acid destroys it. You should feel a light burn or tingle. No tingle? It may be expired. Rule 3. The 5-minute loop. Take 1 dose. Wait 5 minutes. Pain still there? Take second. Wait 5 minutes. Take a third if needed. No enter sign never exceed 3 doses. Warning sign #critical warning. If you've taken Viagra, Cialis, or Levitra in the last 24 to 48 hours, do not take nitroglycerine. The combination can cause a fatal blood pressure collapse. If unsure, skip nitro. Stick to aspirin. Instinct tells people to lie flat. That instinct is wrong. Lying flat floods your chest with blood volume, increasing what doctors call preload. A struggling heart cannot handle extra load. Instead, use the W position. Here's how. Sit on the floor. Back against a wall or couch. Torso at about 45 degrees. Knees bent. Feet flat on the floor. Your body forms a W shape. Why this works? Gravity pulls blood into the legs, easing stress on the heart. Lungs expand more fully. Oxygen delivery improves with less effort. This position consistently shows higher oxygen saturation in distressed patients. Chest pain triggers panic. Panic triggers rapid shallow breathing. That's a disaster. Hyperventilation constricts blood vessels, exactly what you don't want. You must manually activate your body's brake system. The vagus nerve. Use this breathing pattern. Inhale through the nose for 4 seconds. Belly expands, not shoulders. Hold for 2 seconds. Exhale through pursed lips for 8 seconds, like blowing through a straw. The long exhale is the key. It stimulates the vagus nerve, releases calming neurotransmitters, and slows the heart. You are buying time. This is the hidden survival multiplier. There are drugs called thrombolytics, clot busters. They can dissolve the clot and restore blood flow. But doctors can only give them within a strict time window. If you can't tell them when symptoms started, they may legally be unable to use them. Action. Look at a clock. Say the time out loud. Write it down. Or say it clearly to 911. That timestamp could save your heart muscle. You now know what most people never will. 6 protocols. Minutes that matter. Actions that turn panic into control. If this knowledge ever saves a life, even if it's not yours, sharing it was worth it. Leave a like so this reaches someone who might be alone tonight. And ask yourself this. White right pointing backhand index, do you know your family history of heart disease? That conversation matters more than you think. Stay prepared. Stay calm. Stay alive. We'll see you in the next video.